Hello and welcome. We're about to dive into a topic that, can feel pretty complex, multiple myeloma. But the goal here is simple. We're going to break it all down, step by step, so you can get a really clear picture of what it is and how it works.
And let's just start right here, because this quote really gets to the heart of it. Getting a diagnosis like this is, it's overwhelming, and that's completely normal. The key thing to remember, and what this explainer is all about, is that knowledge is a powerful tool. It helps you navigate what's ahead. You are not alone, and there is always a way forward.
So, let's get started on this journey to understanding myeloma. We're going to begin with the absolute basics to make sure we have a solid foundation to build on.
Okay, so at its core, what are we talking about? Multiple myeloma is a cancer of one very specific type of cell, the plasma cell. These little guys live inside your bone marrow, which is that spongy tissue deep inside your bones. And really, to get what goes wrong in myeloma, we first have to understand what these plasma cells are supposed to be doing when they're healthy. A great way to think about your healthy plasma cells is to picture them as tiny, super specialized factories, and their one and only job? To churn out the stuff that protects you.
Let's walk through the life of a healthy plasma cell. It's actually a pretty amazing process. So, your body detects an invader, right? Like a virus. A special cell called a B lymphocyte gets the signal and poof, it changes into a plasma cell. This plasma cell is now an antibody-making machine. It pumps out antibodies that go and fight off that infection. And here's the really crucial part. Once the fight is over and the infection is gone, the plasma cell's job is done. It shuts down. It's a perfect, clean system.
But what happens when that perfectly clean system breaks down? What happens if that factory gets a glitch and just never shuts off? Well, that's where myeloma begins.
Instead of being made when needed and then going away, a genetic mistake, a mutation, happens in a plasma cell. This mutated cell basically stops listening to any of the body's signals to stop. It just keeps dividing, making more and more copies of itself, completely out of control.
And this comparison just lays it out so clearly. On one side, you have your healthy plasma cell, a hero of your immune system. But the myeloma cell, it's the total opposite. It's not fighting infections, it's just multiplying forever. And instead of making all kinds of useful antibodies, all these identical cancer cells are just cranking out huge amounts of a single, totally useless abnormal antibody. And that useless antibody, it has a name. It's called M protein. The M here stands for monoclonal, which is just a fancy way of saying it all comes from one single clone of a mutated cell. So think about it. Our factory is broken, and it's now flooding the system with a defective product that not only doesn't work, but also starts causing all sorts of problems.
Now, myeloma doesn't just appear out of the blue. It usually starts with what we call precursor conditions. There's MGS, which is a very early stage with just a few of these abnormal cells. Then it can move on to smoldering myeloma, which is a step up and carries a higher risk. You can think of these stages as the factory starting to sputter and malfunction, but before it causes a full-blown system breakdown.
So, what happens when these faulty factories just keep running, and these abnormal cells keep piling up? Well, the consequences start to spread, creating a serious ripple effect throughout the body.
As these cancerous plasma cells multiply, they start taking up more and more space inside the bone marrow. They literally begin to crowd out all the healthy cells that are supposed to be in there. And this crowding has some really serious consequences.
For starters, the space for making healthy red blood cells gets squeezed. When you don't have enough red blood cells to carry oxygen, you can get anemia, which is why people feel so weak and tired. At the very same time, your normal, healthy white blood cells, the real infection-fighting army, also get pushed out, which can make you much more likely to get sick.
And the problems don't stop in the bone marrow. Myeloma actively attacks the bones themselves. It's like it sends in a wrecking crew that messes up the normal balance of building up and breaking down bone tissue. This creates weak spots, or lesions, which can cause a lot of pain and even lead to broken bones. And as the bone gets damaged, it leaks calcium into the blood, which causes a whole other set of issues.
And remember that useless M protein we talked about? All of that junk has to go somewhere. So much of it can build up that it can actually make your blood thicker, slowing down circulation. And your kidneys, which are your body's amazing filtration system, get totally overworked trying to clear it all out. Over time, that can lead to some serious kidney damage.
Okay, so with all of these things going on in the body, how do doctors figure out when the disease has officially crossed the line? How do they know it's gone from a precursor condition, like MGUS or smoldering myeloma, to active multiple myeloma that needs treatment right away?
Well, they look for clear evidence that the myeloma is causing actual damage to the body.
And to do that, they use a very specific set of criteria.
It's known by this really easy-to-remember acronym, CRAB, and it perfectly summarizes the big problems we just talked about. The C stands for high calcium in the blood from that bone damage. R is for renal, which means kidney problems. A is for anemia, the low red blood cell count. And B is for bone disease, meaning they can actually see those weak spots on scans. If a person has one or more of these CRAB features, it's a key sign of active myeloma.
This table is a great way to see it all side by side. You can see MGUS has a really low number of abnormal cells and no CRAB symptoms. Smoldering myeloma has higher numbers, but still no major organ damage yet. But once you get to active multiple myeloma, that's when you see those CRAB symptoms, or another set of criteria called SLIM, which we'll touch on right now.
Yeah, the way doctors diagnose myeloma is always evolving. Now they also use something called the SLIM criteria. You can think of these as biomarkers that are like an early warning system. Even if someone doesn't have any of the classic CRAB symptoms, these biomarkers tell doctors that there's a super high risk that organ damage is right around the corner, so they can start treatment to get ahead of the problem.
Look, understanding the what and the why behind a diagnosis, it's the first, most essential step toward feeling like you have some control. It's what lets you ask the right questions. So we'll leave you with this thought to take with you. Now that you have this information, what's the next question you want to ask your team? Because every single question is another step forward on the path.